everyone. Welcome to The Doctor is In on CNN Philippines. I'm Dr. Freddie Gomez. Please start sending your questions about COVID-19 via the CNN Philippines Facebook page because in the next 30 minutes, we will be answering as many questions as we can with regards to COVID-19 here live on the show. But before we do all that, uh, President Rodrigo Duterte made a remark on the use of antibodies to cure COVID-19. So what exactly are these antibody tests and what do they mean for this coronavirus pandemic? So in the United States, the infectious disease experts say that these antibody tests are coming soon. So CNN's Brian Todd has more.
Patients who've come out the other side of having coronavirus call them built-in hazmat suits. They're known as antibodies, and tonight there's a push to have as many Americans tested for them as possible. The tests seen as crucial to getting Americans back to work.
When you're trying to find out whether a person is infected, that's the test we always talk about.
A test for antibodies is not the same as a standard coronavirus test. Antibodies are proteins developed by your body when you're infected with a virus like COVID-19 to fight it off. If you've recovered from coronavirus, your antibodies remain and give your immune system a memory of the virus. So if you get exposed to coronavirus a second or third time,
those antibodies that are floating around in their blood will recognize that virus and will hopefully neutralize it.
So how can testing as many people as possible to determine who has antibodies against coronavirus and who doesn't help get the economy open again? First, by testing people individually and clearing them to return to work.
Whether or not this person can end social distancing, maybe this person should be a frontline worker because they've got antibodies to it.
But also by testing a whole community, or at least getting a representative sample.
Antibody testing in a community might tell you that your community was hit pretty hard with this coronavirus and there's a lot of herd immunity, meaning lots of people were exposed and this virus is unlikely to find that many victims in your community anymore.
But right now, antibody tests are not the silver bullet that will get America's economic engine humming again, at least not as fast as President Trump wants it to. One reason is because, according to one public health advocate, a lot of antibody tests that have been tried out have been unreliable.
The danger in these tests, if you don't understand the quality, is that it could give you a false positive, could give you a false negative. You don't know the accuracy of it, and you could really put people in danger by giving them the wrong information. You could let people go back to their lives when, in fact, they're still infected.
And as treatments like the use of antibodies are being developed, the world continues to grapple with this coronavirus pandemic. Sa laban na ito kontra COVID-19, it is also important to note the number of recoveries. In the Philippines, hundreds of patients na ang nakarecover dito sa disease na COVID-19. At kakausapin natin ang dalawang COVID-19 survivors na magkukwento ng kanilang mga naranasan. So we will first talk to Mr. Julian Thomas Sese. He recovered from COVID-19 on April 7 and is currently undergoing self-isolation at home. Welcome to the show, Julian.
Hello, good afternoon. Thank you for having me.
First of all, Julian, we are so glad that you have recovered. How are you feeling right now?
I'm okay. I'm still monitoring my vitals every day. So I have to do another retest this weekend just to put the nail in the coffin and say na okay na, I'm clear and good.
Naalala mo pa ba, Julian, kung kailan at paano ka nahawa ng sakit at kung ano yung mga naramdaman mo during, anong mga naramdaman mo, yung mga symptoms sa katawan mo during that time?
As far as kung saan ko nakuha yung sakit, I really don't have any idea. Hindi naman ako lumalabas, no? So, nasa office lang ako or sa bahay. Tapos, kung may client meeting sa office nila. Pero I would always wear a mask. I didn't travel outside of the country. I was never exposed to any confirmed positive case. So I don't know where I got it. No. In terms of my symptoms, I actually documented it pretty well. No. So I first got LBM around March 13, in between March 13 and 14, no, midnight. So I woke up And then I went to the banyo. On the 14th, nung gabi, para akong tatrangkasuhin. No? I was feeling very lethargic and very tired. Para akong alam mo yun, medyo lampay yung feeling. No? The next day in the morning, yun na, nag-start na meron akong fever. And at this point, I asked my wife to take our baby daughter, just for safety, to stay at my mom's place, just in case I had anything. Actually, the night before, when I was feeling it na, sinabi ko na sa wife ko, nag-usap kami, and we decided na separate beds muna kami, just to be entirely safe, no? Nung gabi nung 15, yun na, lumalabas na yung ibang symptoms. So, tumataas yung fever, nagkaroon ako ng headache, tsaka body ache. And yung headache and body ache is nothing like ever experienced, no? Parang, the description is parang akong hinahampas sa likod ng ulo ng baseball bat. Tapos bumaba yung pain sa likod. The next day, March 16, there was cough na and extreme chills sa gabi. So, kahit 25 yung temperature sa kwarto, naka-jacket ako, naka-pajama sa loob, naka-socks, 2 layers ng kumot, ganyan. Nilalamig pa rin ako, nangangatog, no? So, I think around that point, nag-try na ako magpa-test. I went to the hospital. Tapos,
Okay.
I actually didn't get tested muna. They just evaluated protocol. It was really just, I think, DOH protocol at that time. So they just gave me a prescription of medicine just to manage my symptoms and rest at home. So 17 hanggang 19, I was just continuing to monitor myself. Symptoms were getting worse. Fever going higher. No, I'm asthmatic also. So some family members that were doctors reached out to other doctor colleagues. No, so I was able to connect with a pulmo who agreed to see me on Friday. But on the 19th, nakakuha kami ng approval to get a test. So I got a COVID swab test no 19, and then an X-ray and blood test. Then I saw my pulmo the day after, and he confirmed na may pneumonia ako and signs of an infection. He also told me because I have asthma. Yes. So because I have asthma.
Yeah, go ahead. What I
Yes.
what I just wanted to comment as you go on with that's a very detailed description. Yung maganda yung timeline mo. I just want the viewers to understand that you are 31 years old. You're 31 years old, a fairly healthy person, living a normal life. So this medyo takes away from the usual notion that it's only the senior citizens or those na mas nakatatanda ang mga delikado dito. I'll comment about some of your pre-existing conditions like your asthma, but I'll let you finish first your timeline or how you describe your illness.
Okay, so March 20, I saw my pulmo, and he told me because I had asthma, to continue monitoring myself, he prescribed antibiotics, and if at any point I find it difficult to breathe, that I inform him right away, and then we'll reassess, no. And then day after, around midnight, that's when I found it difficult to breathe already. Then he recommended I get confined already, no. So I was confined on March 22. I didn't find out that I was positive until 25, I think. Yeah. So I was confined on the 22nd, and then doctors were monitoring my vitals. They would do X-rays and blood work every day or every other day, and they were telling me na nagpo-progress yung pneumonia, tumataas yung markers ko for infection. So I was confirmed positive on the 25th, and then I think the next few days, I just
by this
focused
time,
on
Julian, Yes, by this time, Julian, it's clear that your symptoms were progressing. Ibig sabihin, lumalala. I
Yeah.
think during sa umpisa pa lang, medyo may pakiramdam ka na hindi lang pangkaraniwang trangkaso ito, no? We'll
Yes.
continue on with that and how you actually recovered. But before we do that, let's take some. There are a lot of questions online, with regards. They're watching you, and Monica is asking kung ano daw ang mapinainom sa inyo na gamot para gumaling ka, Julia.
Okay, so yung gamot, I think it's on a case-to-case basis. So right now, wala pa namang proven cure internationally. Diba? We're seeing many different medicines. Some of them are saying anecdotal lang, etc. And I think it's really based on the opinion of all of my doctors at the time because I had asthma then. So they were really reviewing my case. But yung regimen ko was really hydroxychloroquine, Plaquenil,
Chloroquine,
and
yes.
and azithromycin, and then my asthma meds. Yeah.
Okay, so all of these medications were given to you, and because yung immune system was able to take it, but I think a factor here was your previous asthma could have played a part, on the progression ng symptoms mo. So that's a very good way, Julian, that you were able to share that, so people will know what it's like actually to actually have COVID-19 and pretty much get well and live through it. Do you have a message for our viewers, Julian, before we go?
The message that I would like to impart is that it's a terrible disease, and I wouldn't want anyone to get it. So please follow all the instructions of the authorities and the medical professionals. Wash your hands, keep your distance, and really help out our frontliners any way you can, because they're really fighting this war for us. And they're in harm's way every single day, every single hour. And they also have families. So please watch out for them also.
Okay, thank you very much, Julian, and we hope that your healing process continues. Thank you for joining us and sharing your story. So now we have to pause for a quick break, but when we return, kakausapin naman natin ang isang doktor na nakasurvive ng COVID-19. So if you have any questions, please send them here on the CNN Philippines Facebook page, and we will answer them as much as we can. Please stay with us. Welcome back to The Doctor is In, and thank you for being with us. I'm your host, Dr. Freddie Gomez. Now, fighting COVID-19 is taking a toll on our healthcare facilities and workers. Over 250 healthcare workers have already tested positive for the disease. So joining us now is one doctor who has recovered from COVID-19. Welcome, Dr. Joey Hernandez. Dr. Joey, are you there?
Yes, hello, Doc Freddie. Good afternoon. I'm here. Nakikita niyo po ba ako?
Again, Dr. Joey, yes, I know you're there, but once again, we are very glad that you are healthy and recovering. So, as I asked Julian, how are you feeling right now?
Today, 2 weeks na po akong symptom-free. Back to normal, back to work. Just waiting for the negative swab result. So as of yesterday, I already have a negative swab result. Just waiting for one more for final clearance.
Okay, so unlike Julian earlier, no, you stayed home. You stayed at home while treating the symptoms of COVID yourself. Can you tell us more about this?
Well, I was not admitted at all. Luckily po, I had symptoms on the mild side of the spectrum. So the doctors in the hospital where I went to, they assessed me according to the clinical parameters based on the algorithm. And then after getting tested, they said, you can go home, you can isolate yourself in the confines of your own condo unit and just follow the prescribed supportive treatment until nag-clinically recover na ako after a few days.
Okay, so I'll ask you the same question like I did Julian earlier. Naalala mo ba kung saan mo most likely nakuha itong virus or kung saan ka nahawa?
Yes po. So what I'm sure of, I have no travel history to any country other than the Philippines in the most recent months. I have no exposure to any positive or suspected patient. Kasi even if I'm a doctor, I haven't really worked in hospitals for the past few months. My line of work is mainly office-based, though I visit certain private hospitals for meeting. Ang most possible source would be me in crowded places palagi kasi I always take the bus in EDSA every day going to work in Makati. So most likely local transmission.
And bilang isang doktor, nung naramdaman mo yung mga simptomas ng na ito, no? Medyo may pakiramdam ka na COVID-19 na to?
Yes po. With my symptoms kasi closely resembling to what is being advertised na symptoms of COVID, which are watery diarrhea, high-grade fever na umabot ng 40.5, sore throat na with pus, tapos fast and labored breathing, generalized body weakness, one-sided sharp headache, tsaka chills at night. Yun, I had to frame myself na it is COVID just for me to mount the appropriate response. Kasi with the current situation that the COVID cases are rising, we cannot be complacent. So I had that frame of mind in order for me to spur the right action and to alert all possible contacts that I might have COVID.
Okay, so you're also working with other healthcare physicians and local governments that deal with COVID-19, ano? Could you tell us more about that as well?
Ayun po, I'm affiliated with the Philippine Society of Public Health Physicians. So I'm the Secretary General, and then we are collaborating with various agencies, including professional societies, to support DOH, LGU, and the public health sector in fighting COVID. So most recently, the organization jointly developed unified COVID-19 guidelines together with the Philippine College of Physicians, the Philippine Society for Microbiology and Sese, Philippine Society of General Internal Med, and DOH for primary care and for healthcare settings. We also conduct Zoom lectures to people working in the LGUs to support them in various topics such as biosafety, pandemic response, how to set up COVID isolation units. We also do initiatives in risk communication, and then we have upcoming researches in epidemic modeling and antibody testing.
And as a doctor, no, as a doctor, Joey, I'm pretty sure na getting tested was one of your priorities nung medyo may kutob ka na COVID-19 na to. Were there any challenges in you getting a test? Of course, trying to find out the results as well in a timely manner.
Yes po, in my experience, if you are in the hospital already, it is easy to get tested kasi the doctors just have to assess you and follow the algorithm. However, getting to the hospital is actually a challenge with this ECQ kasi di ba yung public transportation natin suspended and wala akong kotse sa Metro Manila. So, kailangan mag-coordinate talaga with LGUs, no? For the first 2 times, the barangay LGU here in Quezon City managed to bring me there. Kaso nung pangatlo na, with the rising cases here in Quezon City, medyo nahirapan to schedule me. So, ang nangyari, I crowdsourced on Facebook, sino ba pwedeng magpairam sa akin ng motor? Kasi kung kotse, mahirap mag-disinfect, no? So, luckily, I had a friend na dinala ko doon sa hospital for testing. So that's a problem with ECQ, no? I had to crowdsource. Second is actually getting the result immediately. So in my experience, I got the result. I was already clinically recovered. No more symptoms. So parang FYI na lang in retrospect, you had COVID, no? So I got my results after 13 days after getting tested, no? With the usual turnaround time of siguro 5 to 7 days na sa ngayon.
So hopefully right now, with a lot more testing centers, a lot more people will get tested and have at least easier experience than what you might have had, Dr. Joey. Before we answer any more questions with Dr. Joey, we'd like to say hi to all our viewers. We have viewers from Qatar, the United Kingdom, Lebanon, and all over the Philippines. Hello to you all. I'm with Dr. Joey Hernandez. Kinukwento niya ang kanyang experience bilang isang doktor at isang naging positive with COVID-19. So, Dr. Joey, ano mga guidelines ang recommend mo sa mga barangays who haven't yet set up a COVID-19 response type of scenario or response unit?
Yes po. So, in the past few weeks, the society, in collaboration with other two organizations, IHO and FAMED, we came up with guidelines to set up what we call Ligtas COVID centers in barangays. Ligtas COVID means local isolation and general treatment areas for COVID-19 cases. So this is meant for those with mild symptoms na suspected, probable, or confirmed cases. Actually, if you're going to search on Facebook, may design na naka-upload sa care of Palafox group. They designed it. And basically, if you are to set up a Ligtas COVID Center, you must have 4 components, 4 S's: the space, the staff, supplies, and special services. For the space, generally, you should have a well-ventilated permanent structure, such as a school gym or basketball court with entrance and exit, no, with unidirectional flow of traffic with signage para hindi magulo. Tapos sana yung confirmed cases separate dun sa suspected and probable. If possible, we can have individual rooms, no, with toilet and bath na naka-separate din. Or if not, you can have a partition, 1.5 meters in separation. Of course, you need hand washing facilities, storage for cleaning and disinfection, laundry, and touch-free trash bins, no? You need also adequate staff. Siyempre, hindi mag-work ang COVID center mo without health workers. So at least 1 manager, a sanitation officer, have midwives and nurses, a doctor, which can be through telemedicine. So like tayo, nag-video call, and support staff such as security and maintenance. We also have to have adequate supplies, yung pangatlo. Supply of health workers, supply of PPEs such as N95 mask, gown, gloves, rubber boots, face shield. Also patient care equipment such as steth, BP app, oxygen, food supply, meds. Lastly, we need the 4th S is special services, no? Because this is a difficult time for patients, so they must have access to emotional support through virtual means, no? Sa PGH, nag-pilot na sila ng laptop na pwede mong makita yung relatives mo if you're a mild COVID patient, no? So also access to psychological, psychosocial, emotional support, and a space to visit at a distance for your family members. So yun po, basic 4S for you to set up your COVID isolation centers for mild patients.
Okay. Dr. Joey, maraming mga nagtatanong, maraming nakikinig sa story mo, and they have some questions. Like Olivia is asking, how about your daily food? Were there any limits to your diet for COVID-19 or for those COVID-19 patients?
For food, there was no limit kasi actually para lang siya, well, if you have comorbidities, no, if you have high blood diabetes, obviously you will have restrictions. But for me, since I don't have other chronic conditions, I can eat as tolerated. Siguro dagdag lang on vitamin C, citrus, vegetables, and water. So yun lang, it's basically what you do when you have flu as well or other viral infections.
Okay, and we have another question from Daniel. Ang tinatanong ni Daniel is, paki-describe po kung paano yung difficulty in breathing para po bang hinahapok. First of all, Dr. Joey, did you experience any difficulty of breathing during your whole course ng COVID-19?
Yes po, actually, sudden nga yung onset kasi nag-start symptoms ko lunchtime of Monday. Nung 7 p.m. na, dinner time, hirap na huminga. So I was actually taking an Instagram story, tapos ni-review ko, parang I cannot complete a sentence without really breathing breathing loudly, and yung respiratory rate ko more than 30, no? Tapos nung gabi, I wasn't able to sleep very well kasi na-interrupt kasi parang barado yung airway mo. Parang kapos na kapos sa hangin, hapong-hapo ka. Together with fever, with chills, with sore throat. So yun, it was a difficult time. So it's like being blocked here in the throat, no? Tapos kapos sa hangin. So yun yung feeling ng difficulty.
Okay, that's a very good description that you had there, no? Do you have a message for our viewers, Dr. Hernandez, with regards to your experience and how should people deal or take care of themselves?
Yun. Coming from my personal experience, I have three takeaway points, no? Because first, when I learned about my COVID diagnosis, I was shocked, no? It's just a blur of emotions because akala ko nun wala na akong COVID kasi nag-recover na ako. So first, we have to acknowledge our feelings in order for us to act rationally, no? We can be shocked, confused for a certain point in time, but we have to contain our emotions kasi we have to act fast. So, that brings me to my second point na we should remain level-headed, rational, and action-oriented. Kasi itong COVID, kapag hindi ka snappy, gumalaw, pwedeng makahawa ng ibang tao. So, pwedeng lumala kapag hindi mo siya inaksyonan agad ka nagpunta sa hospital, no? So, sundin ang payo ng mga healthcare professionals, maging stricto sa pag-isolate. Ibig sabihin, hindi lang separate kwarto, kailangan utensil separate, disinfection of sink and toilet bowl every day. Also, do not be afraid to go to the ER, no? Kapag may symptoms. Lastly, this is the time kasi na where I've seen a lot of people helping me, showing love, care, and support. I guess since we are locked up here in our homes and rooms, no? So this is the perfect time to check on our friends, family members, especially our friends who are frontline health workers, no? Pagod na pagod sila every day with serving the Filipino people. So might as well sneak in a direct message or a personal message. Just check on them, no? Because ito ay isang masalimuot at hirap na panahon for everyone. So I guess we need all the hands, brains, and hearts to support everyone in this cause and contain and combating COVID.
Okay, so very well said, Dr. Joey. No? At maraming salamat po. That was Joey Hernandez for sharing your story with us.
Thank you, Doc Freddie.
And thank you also for all those who sent your questions via the CNN Philippines Facebook page. You know? So the doctor is in. We'll be back tomorrow at 3:30 p.m. Please do join us again at that time. I'm Dr. Freddie Gomez. Stay safe, everyone.